Good morning. You're listening to Senior Scene on your hometown station, 1430 WNAV. I'm Joshua Killian, social media producer with the Anne Arundel County Department of Age and Disabilities, and today my guest is Christy Frazier, Deputy Director of the Bureau of Disease Prevention and Management at the Anne Arundel County Department of Health. Welcome to Senior Scene, Christy.
Thanks for having me here today, Josh.
And as some of us may already know, August is National Immunization Awareness Month. From COVID to flu and from shingles to pneumonia, older adults may have a list of vaccines they have already received or may need to catch up on. Where can someone find the list of vaccinations they should have received by a specific age? And can it be too late to get certain vaccines, or how should we get them?
Immunizations are not just for children. In fact, vaccines are especially important for older adults. As people get older, their immune system weakens and it can be more difficult to fight off infections. Older adults are more likely to get diseases like flu, pneumonia, and shingles, and to have complications that can lead to long-term illness, hospitalization, and even death. For individuals with ongoing health conditions like diabetes or heart disease, getting vaccinated is especially important. Vaccines can protect you from serious diseases and related complications so that you can stay healthy as you age. An easy-to-read vaccine schedule can be found on the CDC website at cdc.gov/vaccines/BPD. Reach out to your healthcare provider for additional vaccine information or to schedule an appointment.
And obviously, a lot of the questions regarding vaccinations that people have been revolving around COVID-19. Could you take a moment to remind us about who can be vaccinated for COVID-19 now, what the vaccination schedule is, and any advice regarding the manufacturer? Like, is it okay to mix brands?
Sure. The CDC recommends COVID-19 vaccines for everyone 6 months and older, and boosters for everyone 5 years and older, if eligible. The CDC does not recommend mixing products for your primary series. So if you've received Pfizer or Moderna for the first dose of your primary series, you should get the same product for the second dose in the primary series. People ages 18 and older may get a different product for a booster than they got for their primary series. Children and teens ages 5 through 17 who received Pfizer must get Pfizer for a booster. Adults ages 18 and over who received both doses of either their Pfizer or Moderna vaccine or one dose of Johnson & Johnson vaccine for their primary series are considered fully vaccinated 2 weeks after their second dose or one dose of Johnson & Johnson. A booster is recommended for most people at least 5 months after the final dose in the primary series. A second booster is recommended for adults ages 50 and older at least 4 months after the first booster. For individuals who received Johnson & Johnson vaccine for their primary series, either Pfizer or Moderna vaccine is recommended for their booster dose. You are up to date with your COVID-19 vaccines when you have received all the doses in your primary series and all the boosters recommended to you. Novavax is the fourth type of COVID vaccine available. It is a 2-dose primary series. An individual who receives Novavax is considered fully vaccinated and up to date 2 weeks after their second dose, as a booster dose is not recommended for anyone who's completed a primary series of Novavax.
And recently, County Health Officer Dr. Nilesh Kalyanaraman gave an update on the county's response to monkeypox. Could you remind our listeners about what the Anne Arundel County Department of Health is doing in regards to monkeypox vaccination?
Sure. Monkeypox is a rare virus spread through close contact. Monkeypox is a public health concern because the illness is similar to smallpox and can be spread from infected humans, animals, and materials contaminated with the virus. Monkeypox is less transmissible and usually less severe than smallpox. Scientists have been studying monkeypox since it was first discovered in humans more than 50 years ago. People at highest risk are those with close contact, including sexual or intimate contact with someone with monkeypox. People at high risk are men who have sex with men, particularly those with new, multiple, or anonymous sex partners. Other risk factors include sharing bedding, towels, or clothing with someone who has been infected. The good news is that there are vaccines to prevent the spread of monkeypox. Right now, there's a limited supply, so we're focusing on people with the highest risk, close contacts of someone with monkeypox. With the FDA approval of a smaller vaccine dose, as supplies increase, we'll be offering the vaccine to more people who are at high or moderate risk. For more information, you can go to our website at aahealth.org/monkeypox.
And lastly, what's the one thing that you would really like our listeners to take away from our talk today?
Vaccination is one of the most convenient and safest preventative care measures available. Getting vaccinated can help keep you, your family, and your community healthy.
Oh, wow. Well, Christy, I just wanted to thank you so much for coming on the show today.
Absolutely, Josh. Grateful to be here, and thanks for having me.
And if you have any questions about today's show, or if you're interested in any of our programs, please feel free to contact the Department of Aging and Disabilities at 410-222-4257, or visit us online. We also encourage everyone to register for our Senior Activity Center programming, which can be found on our website, aacounty.org/senior-center. Please remember to follow us on Facebook, Twitter, and Instagram at AACODOAD, and on our YouTube channel at Arundel Seniors. You can catch Senior Scene first only on 1430 WNAV. Remember to tune in to full episodes on our YouTube channel at Arundel Seniors on Thursdays at 10 a.m. This has been Joshua Killian, social media producer with the Anne Arundel County Department of Aging and Disabilities. You've been listening to Senior Scene on your hometown station, 1430 WNAV.